Good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team. And I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to chemicals in certain food items, allergy to certain medications, insect stings, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early revision. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So today we have with us renowned dermatologist, Dr. Supratim Karmakar, who is a consultant dermatologist, senior resident, Medical College and Hospital, Kolkata. So a very warm welcome to you, Dr. Supratim Karmakar. It's a pleasure to have you, doctor, with us. And today we are going to discuss about a very important topic, rather, which is the management of urticarial rashes. So first of all, we would like to welcome you to the session.
Thank you, ma'am, for those kind words. It's my pleasure to be with you and to be part of this. And I hope that the listeners and the viewers gain a lot of information which can help them in their daily life. And I hope that they can improve their daily life and daily schedule just by gaining knowledge from this session.
Exactly. And it is more important, doctor, because urticaria is quite common, right? And it do impact the quality of life. So first of all, we would like to understand, doctor, what is urticaria?
Actually, the first thing that we need to understand whether anything that itches can be caused as termed as allergies. Okay. So whether that's an urticaria, first we need to diagnose and establish the diagnosis actually. Actually, urticarias, we also can term it as wheals. We can also call it as hives. Okay. And some call it nettle rash and something. And they appear as a raised itchy lesions, which may appear anywhere on the body. Most commonly, it may affect the legs, the arms, the trunk, and the face. Transient skin or mucosal swellings are known as urticaria. These are transient in nature, and by definition, they resolve within the next 24 hours. Okay, so these are known as urticarias, and we also call them as wheals.
Okay, right, doctor. And doctor, what are the causes responsible for urticaria?
Actually, when we talk about the causes, we need to first know what we are dealing with, whether it's an acute urticaria or it's a chronic urticaria. Now, I might emphasize here actually why we are going to classify as acute and chronic, because the causes are different. For acute urticaria, the causes are different, and for chronic urticaria, the causes are totally different. We call those acute urticarias if they are less than 6 weeks. And if it's more than 6 weeks, we call them as chronic urticaria. Acute urticaria's causes are quite common actually. We might have food like any shellfish, any seafoods, any crabs, any pollen, danders, and also some drugs. So we must not overlook them, like some pain medications like NSAIDs. Over the top, we take aspirin almost on a daily basis. Many of us take. So we must be careful. They might cause urticaria. Any infections like upper respiratory tract infections, any environmental factors, the cold or the heat, the sun, emotional stress, or even, regular hard work like exercise may also precipitate acute urticarias. Causes of chronic urticarias are totally different from those. And, we need to elicit why it's happening. The exact cause and the etiology should be identified.
Right. So, n number of factors could be responsible for acute urticaria and for chronic. Many a times, the reason could be unknown, and a lot of diagnosis is done, I'm sure, to understand what is triggering urticaria. Right, doctor?
Yes.
Okay, so doctor, for a layman, because you know what happens whenever we talk about skin allergies, we know that skin allergies are normally, in the form of rashes. They appear on our skin. They do itch a lot. But then, as a layman, to understand, is it urticaria or something else? So I would like you to let us know how does it looks like exactly for a layman, to understand that okay, this is urticaria. I need to go and consult a dermat.
Actually, urticarias may manifest in so many different ways. It can be from a simple, that anything that's itching, maybe the palms or the soles of a person is itching and has been itching for quite some time. Actually, the patient generally takes over the counter, cetirizines and levocetirizines, and once they take, they are symptom free for the next 24 to 48 hours. And again, after that, when the effects of the medication wear off, again they develop symptoms. So that can be an urticaria. Apart from that, we emphasize about those raised, itchy, reddish lesions, which we normally call as hives. They can be a manifestation of urticaria. After having any food, we can get the lip swelling, the mucosal swelling. I'm unable to breathe after taking any medication or any food for some reason, that can be an urticaria. Apart from that, I can have a severe manifestation of urticaria. I might not be able to breathe properly. I might not be able to swallow properly. That can be a severe form of urticaria known as anaphylactic shock. That can be an urticaria as well. So urticaria can have many manifestations. So it is very important that you need to understand whether it's an urticaria or not. And if you're in a dilemma, obviously consult your doctor.
Right. And with what you have just explained, doctor, it looks like that urticaria could be a serious disease. It could be life-threatening as well. So please, we would like you to shed some more, light over it. How dangerous it could be.
Actually, urticaria can have, it might impair your normal daily activities, actually. So urticarias might hamper your daily activities in such a way that, patients just generally become depressed after a prolonged period of time. In case of chronic urticarias, some of my patients, they have so depressed, they try to even commit suicide as well. So we definitely need to diagnose those urticarias and treat them in a proper way. And we should give them proper medications. And previously we used to have some sedative antihistaminics. We have antihistaminics for urticaria. These non-sedative antihistaminics are a boom to us basically, because whenever we give them medications like levocetirizines and cetirizines previously, patient, what they used to do, they used to become drowsy the next day. Patients, they say that they won't be able to wake up on the bed and do their normal daily course actually. So nowadays we give them non-sedative antihistaminics which are much more advanced, and they don't feel drowsy at all, and so the prognosis is better actually. And apart from that, if urticaria actually is a one-off incident in case of acute urticarias, but in sometimes if you develop a severe anaphylactic shock, that is very difficult. Actually, you might go for any raised and decreased blood pressure, unable to breathe, stridor, GI upset, joint failing, joint swelling, everything. Okay. So we must need to understand and diagnose this condition. And we must not actually ignore this, because this is a long-term treatment that you require here. And my emphasis will be on the duration of the treatment. The patients, they take over the counter medications for 1 day, 2 days, and they take only 2 or 3 tablets, and again they develop symptoms. And it is natural for them to develop the symptoms when the effects of the medicines wear off. So we might need to understand and make them conscious about the chronicity of the disease in case of chronic urticarias, and also prevent and educate these known triggers.
Right. The whole purpose of having this session is, doctor, to understand and aware people, about what is urticaria and why it is important to go and, consult a qualified dermatologist rather than going for home remedies or over-the-counter medications, because that could be really fatal. It's important to understand that how important it is to consult the right person and trusting your doctor, following the whole prescription and following your doctor is really important. We'll talk about that as well. Before that, you also mentioned that many a times, you can have swelling of organs, which can make, it hard for you to breathe or eat properly. How dangerous it could be?
It might happen that the person may find himself or herself in some anaphylactic shock. Now, anaphylactic shock is something where you have, your blood pressure is decreased. You are unable to breathe properly. What happens? You are unable to breathe. There is some decreased oxygen in your body. Your organs won't get oxygen. So, you might go in for a shock and you might even die from that. So, it's very important that you diagnose this disease, and in this case obviously call for help basically. And these patients who have this problem, is not the first time generally that the patient is suffering from those. Is maybe their second or the third time, and actually there are some precipitating factors for that. Those factors patient must identify and refrain from getting exposed to those factors. And once these patients in the Western countries, they usually carry an EpiPen, that is adrenaline. Adrenaline is injected intramuscularly. So once the patients develop these symptoms, they themselves inject with this EpiPen or adrenaline. And this might help to save the life of the patient. So we need to understand and need to raise awareness about this condition.
Right. And doctor, as you said, it is really important to go and consult a qualified dermatologist so they can, diagnose what's triggering, what's the root cause, and try to find out the cause. So it's really important to go and consult the dermat. Now, the thing is, in India, in our society, because it's so easily available, over-the-counter medication, right? So normally, because we know it's, some kind of allergy. So as you mentioned in the beginning, we'll go ask the chemist that, I'm having allergy. Please, give me some anti-allergens. We know them by name, even if I don't want to take the names, etc. But then because it will give you instant relief for a day or two and we'll forget about the thing. Only when it becomes really difficult for us to control, only when it starts, hampering our life, our quality of life to a great extent, that's when we go and land up in front of a doctor. How dangerous could be over-the-counter medication or self-medication?
Over-the-counter medications, generally these are long-term. See, one of tablets might be okay, but generally if you're taking these medications in an unsupervised dose, these medications have a long-term effect. They might damage your liver, they might damage your kidneys as well. So it is very important, you don't self-medicate actually. And sometimes the patients, even when the symptoms don't subside, even on taking medications, these patients, they overdose themselves. Overdosing of medications, you don't know what's the correct dose. You don't know the upper limit of what or how much you should take. So it's very important that you consult your doctor and be in touch with your doctor if you have any problem. So it's important that you consult your doctor and follow their advice. You have to follow their advice diligently.
Now, very common question, you have also talked about it, that the patients who are suffering from chronic urticaria normally ask is that, will it ever go away? Will it go away permanently? How, long I need to take the medication and all? I'm sure your patients also come to you and ask the same questions. So normally, what's your reply to them?
Actually, the first thing about chronic urticarias, we need to find out the triggers that I mentioned properly. And the triggers are, most of the cases, they might be inducible triggers, some physical stimulus, might cause them, some underlying autoimmune disease. The most important and the most common disease, that is an hypothyroidism. We need to talk about that actually. If the patient has an associated hypothyroidism, and along with that, if she has any urticarias, so that might indicate that the patient needs a long-term therapy. That might be more than 2 years, might be more than 3 years, 5 years, even 10 years, 20 years as well. So the first thing, before prescribing, you should educate the patient. See, you have this problem and you need to take these medications for the next 20 years also. So the patient is already mentally prepared that she needs to take these medications, and also rest be assured that these taking these medications for the next 15, 20 years might not, and if properly given in the correct dose, will not affect your problems. So you must not self medicate actually, and take the medication in the proper dose that your doctor is prescribing, and you should be in your contact with the doctor. So chronic urticarias in most of the cases, apart from the underlying causes, they usually last more than 1 year. So whenever you are starting these medications, you need to be prepared that you are taking this medication for more than a specific period of time, more than 6 months and 1 year. Generally, what I do is I give medications for the next 3 months. After 3 months, I take a 7 days gap when I don't give medication to the patient. And after that, if the patient is suffering from 2 or more episodes per week, we label this as chronic urticaria. And again, I start the prediction for another 3 months. And this is how I go on continuing till the patient is having no more symptoms.
Okay. Now, normally what happens, for example, I'm suffering from chronic urticaria, and you have given me a prescription of 3 months or 6 months, whatever. I've started following it religiously. Now, I have suddenly started feeling that I've got relief, right? It's not bothering me anymore. I won't even go and consult with you or call you. I'll stop the medication all by myself. Then again, maybe after 3 months, 4 months, I'll start having the symptoms. Because I have the prescription, why would I, bother to call you? I'll go get the medicines and again start still medication. Now, I'm doing it all by myself, even if I have a doctor's prescription and initial consultation. How okay it is to, do such practices, or could it be dangerous or harmful?
Actually, the thing is like when maybe you have a symptom initially, I've started you on a higher dose. Okay. I've asked you to take it for a certain period of time, maybe 2 months, maybe 3 months. I know that if you take this medication for that duration and for that dose, you'll be okay with that. I know also that you should not take this for maybe say 4 months, 5 months, 6 months. You are not visiting me. You are taking the medication and continuously taking it for the next 1 year. So who knows what will happen? Okay, so you might overdose yourself. No. So what I do actually, I usually start these patients with the normal dose. If the symptoms are not controlled, I usually escalate the dose. Say after escalating the dose, you find yourself completely symptom free, and you feel like I won't visit the doctor again. So what you do, you say I'm done with this. I don't have this disease, and I am not gonna take the medication. Then after a certain point of time, you have this symptoms again, and you again start taking that dose. Okay, now you're taking it dose for more than the prescribed period of time. So now you might develop some side effects from that medications. So it is important that you don't self-medicate.
Right. So please, go to the right person, which is a qualified dermatologist in this case. B, trust the doctor, follow the doctor. Don't do self-medication. Self-medication can actually worsen your symptoms. Now, doctor, what are the potential complications of urticaria if left untreated?
As I said before, if acute urticarias are usually a single incident or one-off incident, and usually the symptoms last less than 6 weeks. And sometimes the symptoms last less than 6 weeks. And if the symptoms are not being relieved, we might do some other tests and, make sure that whether is causing some underlying problem. Okay. So in that case, we might need to order some tests. And let's say that we are not taking this medication for some period of time, and there is some another precipitating factor. We don't know that because we haven't consulted the doctor yet, and we don't know what's the precipitating factor. And now this time it's not just an urticaria; it has progressed the entire body, involved the entire body, and now we are having the respiratory problem. We are unable to breathe. You are having some GI problems. You are unable to swallow. You are having stridor. You are not able to breathe properly. You have this entire edema of the face. Your mucosa has got swollen up. You are unable to speak. Your larynx, the voice box, is all swollen up. So that's an anaphylactic shock. And that time you might need to get yourself to the hospital. You might land yourself in a hospital emergency. That's an anaphylactic shock. You might need to get intubated even. So it's important that you recognize these known triggers and stay away from them.
Right. urticaria, could be life-threatening as well. It can go till that level. So please don't make it that worse. Go and consult the right person. Go and talk to a qualified doctor, and you will get relief. That's the best part. If you are suffering, many times, doctor, it also happens because, uh, a person is continuously itching. So, his sleep is disturbed, his whole lifestyle has gone for a toss, routine has gone for a toss, and he is definitely in a lot of stress. Now, my question is, can urticaria be caused by stress or aggravated by the stress? It looks like a vicious cycle to me. Stress aggravating urticaria giving birth to stress. It's look like a vicious circle.
Uh, Regarding this, let me share an incident that happened with me actually last yesterday actually. Okay, so a patient came to me. Actually, he's basically a CEO of a multinational company. I never understood that. He just was dressed in plain clothes, and I was just examining him. Actually, he said that he used to have urticarias. Actually, he used to have urticarias. It was treated by a doctor, and he was completely symptom free for the past 10 years. And now, off late, what he's having the symptoms again. So he's so worried actually. And I asked him, "What's new?" I tried to take some history. What's the triggering factor? Why is it happening again after being dormant for the past 10 years or so? So he said that he lost his father. Actually, he's in his village right now. He is a CEO of multinational company, but he has returned to his home village. But he is having these symptoms because after he was so stressed because he lost his father. He has been under a lot of emotional and physical stress. He has been running here and there, and so after that stress he's having symptoms again. So this is my first hand experience. I got to know that such an emotional trauma can even reactivate a dormant disease like urticaria. So yes, emotional stress can be a triggering factor.
Right. So what do you normally do as a doctor? Do you also, because I think consultation or counseling is equally a important part of treating urticaria by what you're saying, because it do involve a lot of stress. People might go in depression, and definitely their quality of life is at risk. So what do you as a doctor normally do to counsel them?
As a doctor, I actually see counseling. I generally first thing is I reassure them and first educate them about the nature of the disease, and this if it's not being treated, so it might happen your daily quality of life, and also being treated by the right person in the right dosage by the right medication is useful and helpful. Why I'm focusing on the right medication, because I previously talked about this non-sedative antihistaminics or non-sedative medications. Earlier days, we used to take the sedative medications. So what happens? You are symptom free in the night. You are not getting a proper relief and proper good sleep at the night. But again, in the morning, you are drowsy. So again, you are not happy because you are urticaria and symptom free. You don't have any urticaria. You are symptom free, but you are drowsy. So what will that cause actually? So no. So now we have this medication. So apart from that, I always see that my patient is depressed. I generally reassure them and usually refer them for a psychological counseling. So psychological counseling helps them, and patient needs to accept the fact that this disease is gonna be there for a certain period of time, and taking these medications will help the person and not do any harm.
Right. And there are people like who are diabetic or, who have hypertension issues. They take medication throughout their lives. And that's how it is. It's safe otherwise, but it's important to take the medication as well. So the same goes for urticaria, I guess. So just you need to understand and get synced with what your doctor is thinking about. So yeah, that, again, I'm saying trusting your doctor and understanding the whole concept is equally important. I can understand, doctor, definitely, because it involves so much of itching. Many a times I've seen people who has stopped socializing or who don't go, their public life has gone for a toss, who don't go out because they know they'll feel very embarrassed and all. But yeah, definitely going to a doctor is important. And many a times these patients also complain that their urticaria or hives get worse during night. So is there a correlation, doctor, of the urticaria getting worse during the night?
Actually, in certain cases, thing is like the main symptom of urticaria is pruritus, also known as the itch. What happens during the day? Then the patient is preoccupied with other stuff. He has his mind on, he has to go there, he has to do this kind of
Right.
activity,
He
he
has got
has to return
work
to
to
the
do.
home. During the night, he's all tensionless. Actually, there is no tension. He's thinking of getting a good night's sleep. And when your mind is all clutter free, and now you have these symptoms. Okay, so your tendency is to focus on where it's itching, why is it itching, and when you will go away. So this all we are focused on, the pruritus. So apparently it seems that the pruritus is happening at night, but it actually happening throughout the day as well. So all we are doing during the day, we are not focusing on the symptoms. We are just focusing on our daily chores and everything. And the night, when we're all done, we are all going to the bed. We are not focusing on where is itching, why is it itching, and that is why we generally perceive the symptom is happening more during the night. It's actually true for all kinds of itch as well, not just urticarias. Even the
Right.
scabies might, the scabies also have this kind of itching. The itching becomes worse at night. Patient complains, but actually we need to understand this happening throughout the day. It's just we are focusing more on the symptoms at night. So when you are free and
Right. It's mostly because we are preoccupied during the day and during night we are all by ourselves. So, right. And again, many times patients will complain that they are feeling very tired or fatigued. So, again, I guess it is because of the itching, continuous itching.
uh, if the patient is feeling tired or fatigue, is mainly because the patient is taking over-the-counter medications. That is
Okay.
the main reason. It causes drowsiness, sleepiness, the lethargy, that inability, to go out there. So, just take the day off, maybe the next day or the other day as well. So you have to understand if the patient is fatigued, it's because mainly the patient is taking over-the-counter medications. And obviously, in rare cases, it might be because of that the patient is having any underlying systemic or other serious conditions. We need to evaluate for that further.
And very rightly said that, because these over-the-counter medication do have the, drowsiness or sleepiness kind of side effects. Now, for example, if I'm a driver and my work involves driving or something which, needs alertness and attentiveness, now the chemist doesn't know about it. I won't even tell him because he's not a doctor. But then that could be actually dangerous in other ways as well.
Yeah, that is why it's very important for us, even, when the patient comes to us, we need to talk about what he does, what his profession is, what is, I mean, if the patient is an pilot, aircraft pilot, we have to tell them, if we are giving this medication, you must not take this medication before you're going out for your job. Maybe if he's a driver as well. So yes, yeah, it's very important to take the history as well, what the patient does for his, job, and prescribe him appropriately. And some people in the IT sector, actually, those people, day night cycle is worse for them. They work during the night and sleep during the day. So we need to give this
Right.
medications. And I have lots of patients who usually sleep during the 7 a.m. in the morning. So I tell them, take this medication whenever you are going to bed. Maybe it's 6 a.m., maybe it's 7 a.m. Take this medication then, and go to bed. So we might need to modify the dose, and obviously might need to modify the timing when the patient should take the medication. So it's important to take the history and what the patient does.
Right. And doctor, do kids or children, they also can get urticaria?
Yes, now it's very common for children to get these urticarias. Earlier, the problem we used to face, the kids generally don't like to take medications, so they don't like at all. So the parents used to force them, take these, take this. So now, obviously, we have developed certain stuff and certain syrups as well, so for the kids as well.
Many times we have observed, right after, recovering from a fever or infection or some kind of disease, especially in kids, we see a lot of urticarial rashes on their bodies. Is there a connection, correlation, and what to do?
Actually, this, yes, many acute urticarias the kids will have after the developing triggers, like upper respiratory infection. Kids often develop sore throat. After an episode of sore throat, they might develop any urticaria. It might be both acute, lasting less than 6 weeks, and might be chronic, more than 6 weeks. If it's lasting more than that, we need to, make sure that whether it has any underlying problem. The kid might have any underlying problem like thyroid problems and other stuff. We hope the kid doesn't have, but anyways, we need to evaluate and look for it, and treat the patient accordingly. We might have to treat both the urticaria that the patient is having and also the disease, the underlying disease that kid might be having. So it's important, and also most important part of any treatment regarding a pediatric age group is you need to counsel and treat the mother first and the parent first. Actually, we have to tell the patient, take these medications. Often the patients are worried, this my kid might have some side effects taking these medications. So we must reassure them, if you take these medications, you will not develop any side effects. And obviously, and make sure that they are taking it in a proper way, in a religiously and diligently.
Fair enough. And doctor, is there any dietary precautions, any do's and don'ts for patients of urticaria?
The dietary precautions mainly, the first thing the patient asks when they develop these urticaria is they say, okay, what do I need to restrict? Most of the cases, drugs and this food are only the 1% of the cases. So in the rest 99% of the cases, they are not related to any dietary foods as well. So, but some cases we need to make sure that these patients, they don't take this seafood, shellfish, any peanuts and crabs. So this might cause urticarias, but they are rarely the cause actually. So they might take those seafoods and everything, but we can have a food diary as well. If the patient is suspecting the patient will have any symptoms after having certain kind of drugs, the patient needs to make sure that he or she is maintaining a food diary. And after that food diary, they can take the diary to the doctor, and the doctor might correlate that whether he or she is having the symptom from that particular food. And only then, we can tell the patient, don't have this food. You might have allergies.
Right. And doctor, especially in last 2-3 years, with COVID, we have seen a lot of patients complaining after getting COVID positive of urticaria. They also got hives. So is there a correlation between COVID and urticaria?
COVID and urticaria, COVID, we can say that, it can be any other infection. Okay, any infection might cause urticaria. Could be a simple sore throat or a streptococcal infection. Any influenza might cause, and COVID is sort of an influenza as well. Okay, so yeah, definitely post-COVID, many people have developed urticaria, and actually, since the prevalence of COVID has gone down, thankfully for the in the past 2 years or so, so the prevalence of urticaria is also decreasing post-COVID.
Right. And doctor, when a patient comes to you with articarial rashes, do you, advise some test, or just by clinical investigation you can, find out that, yeah, this is urticaria and what should be the line of treatment?
Actually, if the patient comes to me with urticaria, so we know this, we diagnose this as urticaria and give the treatment. If we have a clinical suspicion that the patient might have any underlying problems, we might order some routine tests. The routine screening tests, a complete blood count can be given. Any other ESR can be raised. We might even examine the stool or any parasitic ovum as well. And also, if there is any bleeding manifestations, we might need to do an colonoscopy or endoscopy for that case. And also, we might need to do skin biopsy in certain cases. So depending on the patient, we generally give tests, but that's very rare actually. We generally, it's a clinical diagnosis and we need to treat this for a prolonged period of time. And obviously, we check for underlying diseases like any autoimmune diseases like thyroid diseases, any rheumatoid arthritis, any systemic lupus erythematosus. These are all chronic autoimmune diseases. It might precipitate and cause urticaria in the long term for a long duration. So we might check if we have adequate clinical suspicion. Only then we adopt tests. Else is we generally don't order and we prescribe the medications.
Okay, and what treatment options are available, doctor?
Treatment options, mainly we give antihistaminics, the sedative ones and the non-sedative antihistaminics. Apart from that, we actually, what we do is, before giving other agents and other stuff like systemic corticosteroids and everything, we generally updose it. We updose it to the mark, 4 times the normal dose. We give it for certain period of time, even if the symptoms are not going, then we updose it. And then after updosing it, even if the symptom is there, we generally add other agents. We might add any systemic corticosteroids, we might add other agents, we might even give injections as well of monoclonal antibodies. So these are mainly the treatment modalities. Again, it is all prescribed by a doctor, and we should follow this diligently. Us.
Okay. And doctor, is urticaria contagious?
Yeah, most of the cases the patient mainly asks whether is my close ones will have this symptom as well. So most of the cases the urticaria as a disease is not contagious. But if the disease which is causing the urticaria, if that is contagious, then I will have the disease from my close and nearby ones. But as a whole disease process, urticaria, it is non-contagious. It is not contagious at all. But the etiological agent that's causing the urticaria, if it's contagious, then obviously the near and close ones will be affected by that.
Again, doctor, a very normal thing that we do in our society is to do home remedy for whatever problem we have, especially for skin and scalp. We'll try a lot of home remedies. Now, again, with urticaria, people, first initially they'll try to fix it from their kitchen. They'll try something. Normally, they'll use aloe vera or cold compression, but many times they'll use other ingredients as well to calm it down. What's your stand, or what's your say on this?
Actually, these home remedies are mainly these agents which we apply from on top of the skin when it's edematous and having those symptoms. So what it does, it does more harm than they do good actually, because this aloe vera and any other topical treatment won't work on these urticarias. It is just a symptom of the skin, and it's symptom which is happening from underneath. So whatever you are applying on top from the outside will not affect or will not rather improve your chances. Rather, what happens when you're applying this certain stuff, we don't know what any certain person will apply any certain stuff. Okay, so what will happen then? We might develop a rash to that actually. If my body will develop a rash to that, then again it's another problem. It's an eczema, it's a dermatitis. We need to treat that first, and then we need to talk about the urticaria. So we might definitely worsen that, but not help them at all. So home remedies are definitely no.
Right. So home remedies, over-the-counter medication, self-medication, asking a family or friend, it's all a big no-no. You just need to go and consult a qualified dermatologist. Don't fall for quacks, etc., or influencers on social media. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yeah, the take-home message for our viewers is, just if you have an urticaria, consult your doctor, because we need to prepare you for whether you need to take these medications or not, and for how long you need to take this medication, what dosage you need to take these medications. What will happen, even after taking your recommended treatment, you might worsen. We hope that you don't, but in certain cases you might worsen. And what to do in that case, and what to do when you are having those problems, and make sure that you are not developing an anaphylactic shock as well. So you need to stay away from certain triggers, and we need to find that what those triggers are. In most of the cases, those triggers are identified, and we ask the patient to don't use those medications, and don't do that. Stay away from this, stay away from this food, stay away from this tablet, stay away from these drugs, and appropriate treatment is also important. So it's important that you don't take these decisions yourself, because we are the experts in this field, and you must consult us actually. We know what to do, where, what to do when, and we will advise you accordingly. And we will make sure that you are okay, and you don't develop any side effects from self-medications. So consult your doctor, and take those advice in a very religiously and diligent way.
Absolutely. Thank you so very much, Dr. Supratim Karmakar, for your valuable time. And it has been a very informative session for our viewers. And I'm sure they'll use this, information to prevent themselves and their near and dear ones from getting urticaria. And in case they get to see such symptoms, they at least now know that instead of self-medications, it's always better to approach a nearby dermatologist. It was great hearing you. Thank you very much once again.
Thank you, ma'am. It's been a pleasure for me as well. I hope everyone has learned certain stuff about the urticaria and hope they incorporate these advices in their daily routine. I wish you all the
Absolutely.
best.
Thank you, doctor and viewers. Thank you for your active participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Goodbye. Good day.